My name is Mark Patterson. I'm a child neurologist at Mayo Clinic. Today I'd like to talk to you about the specialty of child neurology, how we differ from adult neurology, and the types of services we offer to children with neurological conditions. Child neurology is a specialty that is formally quite young. The first official certifications are only 40 years old, and so the first generation of child neurologists who are certified is now coming up to retirement. There are about 1,000 child neurologists active in the United States. With a growing population of young children, our services are in great demand. Child neurology covers the same areas as adult neurology, but the emphasis is different. In children, we are particularly interested in every case in how a neurologic disorder might impact their development. And so indeed, a substantial proportion of our practice is in seeing children who have developmental delay. That is to say, they're delayed in their development in one or more areas, either their fine or gross motor abilities, their language ability, their socialization, or some combination of those. So within that field, a number of children may have specific disorders. Some children, for example, with delays in their gross motor development may have cerebral palsy. This is a condition and a term that's widely used but not necessarily well understood. In fact, it was introduced more than a century ago by Sigmund Freud and Sir William Osler. And cerebral palsy simply refers to a disorder of the motor system, where children have abnormalities of movement, tone, or posture that result from a non-progressive insult to the developing brain. Many people feel that cerebral palsy is synonymous with birth injury. In fact, we know from a very large study that was conducted in the late 1950s and early 1960s, called the National Collaborative Perinatal Project, that only a minority of children who have cerebral palsy actually have their problem because of birth injury. We now know that in many cases the primary problem is genetic, either a metabolic disorder, a chromosomal abnormality, or in some cases a malformation of the brain that's visible on imaging studies. And so that's a substantial proportion of our work. And here at Mayo Clinic we have a specialty clinic devoted to children who have cerebral palsy. And this involves the collaboration of our colleagues in child neurology, physical medicine and rehabilitation, physical and occupational therapists, speech therapists, orthopedic surgeons, and other specialists whose services may be required to help these children. Another related area in which we spend time in child neurology is that of congenital malformations, and the most common malformation of the nervous system is spina bifida. This is a disorder that occurs very early in development, within the first few weeks after conception, before many women are aware that they're pregnant, where the neural tube fails to close. Most commonly this occurs at the caudal end of the tube, in the lower part of the back, and parts of the nervous system are actually exposed at birth. These children have varying degrees of paralysis of their legs. They may have problems with bladder and bowel control, and in some cases they also have an associated malformation of the brain stem called a Chiari malformation, which causes hydrocephalus. These children need surgery for their treatment, both to close the defect in their back, and in many cases they require decompression of the back of the skull or the placement of a shunt to treat their hydrocephalus. Again, this is an area where we work as a team at Mayo Clinic with our neurosurgeons, the urologists to help with problems associated with bladder function, and the other specialists I mentioned, including the physical medicine specialists, therapists providing physical and occupational therapy, speech therapy where needed, and so on. Another large area of our practice in child neurology is epilepsy. In fact, about half of child neurology practice relates to children with seizures. The good news is that most children who have epilepsy, which simply refers to recurrent unprovoked seizures, are easily controlled, often with a single drug. Of course, here we have specialists who deal with children who have more difficult forms of epilepsy, which are refractory to medical treatment. Fortunately, we have many options available now, including the ketogenic diet, which was pioneered at the Mayo Clinic in the 1920s, the vagus nerve stimulator, a newer form of treatment, and for those children who are suitable, that is to say their seizures are arising from one part of the brain where you can safely remove that tissue, surgery may be an option. And again, we have a team of specialists who work together to help children with these problems. Another important part of our practice is headache. This is the same as in adult neurology. Many people are not aware that most common headaches, particularly migraines, actually begin in childhood. And in fact, until fairly recent times, it wasn't recognized that this is a disease that begins in children. Again, the good news is we have multidisciplinary teams to work to help these children. In most cases, migraine can be controlled with a combination of approaches that include recognizing aspects of a child's lifestyle or diet that might be precipitating or exacerbating their headaches, advising on treatments for acute episodes of migraine, and finally, in certain cases where children need it, providing medicines to prevent the headaches coming or to make them less frequent or severe. We have particular expertise in an uncommon group of disorders which are known as neurometabolic diseases or inborn areas of metabolism. This is a very large group of many hundreds of genetic disorders. Individually, some of these are very rare, but collectively, they're quite a significant health problem for children, and we're now recognizing for many adults as well. Both myself and my colleague, Dr. Deborah Renaud, have had special training in these disorders, and we see many children with this type of illness. Again, we work in close collaboration with our colleagues in other specialties, particularly medical genetics, who can offer particular expertise in counselling families and working together to make these diagnoses. It's encouraging that many of these diseases now have effective treatments. So, for example, there are a number of lysosomal storage diseases in which the deficient enzyme can be replaced by giving it intravenously. Some children will benefit from hematopoietic stem cell transplantation. Dr. Renaud and her colleague Dr. Khan in pediatric hematology oncology have recently begun a program for the peroxisomal disorders. This is a family of diseases many people will be familiar with from the movie Lorenzo's Oil that describes X-linked adrenoleukodystrophy, which is the classic form of this disease. Another area where we have special expertise is that of pediatric neuro-oncology. Our colleague Dr. Jacina Keating has specialized training in this field. And again, this is an area that has really shown great promise in child neurology. Many years ago, brain tumors in children were regarded as a death sentence, but today they can be treated very effectively, particularly tumors such as medulloblastoma, for which there is effective chemotherapy, as well as other modalities of treatment, particularly surgery initially for diagnosis. There are, however, a wide range of tumors. We are involved in nationwide protocols to study these, and so we can offer children the full range of support that they require to deal with these illnesses. And I should emphasize not just children, but families as well, because we recognize that diseases of the nervous system, in fact any disease in childhood, does not just affect the child who's affected, but every member of the family. Another area of practice in which we have a great deal of experience at Mayo is in neuromuscular diseases in children. These are disorders that affect the anterior horn cells of the spinal cord, such as spinal muscular atrophy, the nerves themselves producing various forms of peripheral neuropathy, the junction between muscles and nerves, which causes various forms of myasthenia, including the many congenital myasthenic syndromes, the majority of which have been described here by our senior colleague, Dr. Andrew Engel, and finally, primary diseases of muscle, which includes congenital myopathies and the muscular dystrophies such as Duchenne and Becker muscular dystrophy. We again have the great advantage of being able to work with our adult colleagues in this field, particularly Dr. Dick and his team in peripheral nerve disease, and Dr. Engel and his colleagues for primary muscle disease. So not only are we able to bring together the clinical expertise that's important to diagnose these disorders, but the neurophysiological testing, that is nerve conduction studies and electromyography. We have one of the largest and most experienced laboratories in the world conducting these tests, as well as the muscle laboratory, which performs muscle biopsies, special stains, and even can perform neurophysiological studies and molecular studies to make very precise diagnoses of these disorders. And in the case of peripheral nerve disease, our colleagues have particular expertise in biopsying peripheral nerves when this is an important option. So again, the emphasis is on working as a team and providing complete care for the family in terms of making a diagnosis and then providing ongoing support and a plan of management to help them and their local physicians when they return to their community. So to summarize, I have the privilege of working with a very experienced and capable group of colleagues. All of us share a common enthusiasm to help children who have neurologic diseases, and we have a number of wonderful advantages working here at Mayo Clinic. First of all, our colleagues in paediatrics are physically close by, and so we can collaborate directly in providing a team of professionals to care for children with neurologic diseases. In addition to that, we have the wonderful privilege of being part of the adult neurology department at Mayo Clinic, which has been consistently top-rated in the United States by US News and World Report. We have access to the resources of an enormous department, again, with very friendly and helpful colleagues who are always happy to provide their very specific expertise if it bears on the diagnosis and management of a neurologic problem in children.